I'm Dr. Joe Agnello. I'm the owner of Body Logic MD of Denver, and I run a practice in anti-aging medicine. My basic training was as an anesthesiologist and a chronic pain specialist, and for a long time I was mostly hospital-based practice, but I did very active office practice in chronic pain medicine, and that was kind of a segue for me to this kind of medicine, because a lot of the issues that you see with chronic pain patients are very apropos to everything that anti-aging medicine is about. So, unfortunately, I wish I knew 10 or 15 years ago a lot of the things that I've learned in the last 3 or 4 years. They would have been tremendously helpful in taking care of a lot of those patients. Some people who come to me are, already doing a lot of good things and taking care of themselves, and they just want to optimize that and stay healthy. But there are also a lot of people who've spent 40 or 50 years completely destroying their health, and they're looking for someone to do more than just say, oh, you've got hypertension, or oh, you've got diabetes, and here's the 2 pills that you should be taking. Because there is a lot more to medicine than just taking people and treating one symptom and thinking that you've done something really good for them. The Body Logic approach is mind, body, and soul, basically. These people can benefit greatly from changes in exercise patterns, making sure that they get good sleep, making sure that they make significant changes in their diet, and then adding in supplements, many of which can either replace or minimize the need for medications that they've been taking. Part of the initial evaluation, in addition to doing testing, which will look at more traditional medical kinds of issues, is of course to look at their hormonal balance. So what we do that is significantly different from what I would have done if I was doing this, say, 5 or 6 years ago, is that we make use of things like salivary testing, urine testing, to look at hormonal levels. If you test those things in the blood, and this is one of the things that I've learned as I've been coming to these courses, the blood really does not give you an active reflection of what the active levels of testosterone, progesterone, estrogen, cortisol levels are, whereas salivary testing does. And urinary testing would also do that. But the salivary testing is really one of the key differences, so that we get a very accurate reflection of what the patient's absolute hormonal levels are and what the balance between the different hormones are. And that's really a key starting point in designing a therapeutic plan for these people. And I would say probably 95% of the people that I've seen in my practice so far have basic issues with these things. So, you have to get those in order to effectively begin to address other issues that may be going on. When you look at, what the functions of the hormones are in the body, and I'm talking about, primarily about estrogen, progesterone, testosterone, thyroid, and cortisol, what you learn is that even though people may come in with complaints that are related to sex hormones, these hormones have receptors and actions in all of the major organ systems in the body. So we're talking about brain, we're talking about heart health, we're talking about bone health, we're talking about the optimal functioning of your immune system so that you can resist infection, fight infection when you do get sick, general tissue condition. All of these things are affected in major ways by these hormones, so that while a person may come in because they're having issues with hot flashes and maybe not sleeping well at night, the long-term benefits of correcting these things are decrease in the chronic diseases that most people associate with aging: high blood pressure, diabetes, cardiac disease, osteoporosis. all of them are impacted in major ways by hormone balance.
I have a 6-year-old at home, and when I started the search, she was about 3, so I would go to doctors and just tell them I had no energy, and that, well, you're a mother of a 3-year-old. Of course you don't have energy, but it was something deeper than that. I was so tired, and my hair was falling out. I just did not feel myself, and I'm usually a very energetic person. I always was my whole life. I went through several doctors actually, and each one of them would tell me that normal range. They checked my thyroid, they checked basic blood work, like blood count and certain things, and they said, oh well, you need to find ways to relieve stress, do yoga, different things like that, and nothing worked. And I saw the Oprah show with the Body Logic and the bioidentical hormones. I just saw it, and something clicked, and I said, I'm going to try it, and I'm so glad I did. So I started on progesterone, felt a little better, but as I now know with the whole bioidentical, it's a symphony. So with the progesterone and the thyroid, now myself. Yeah, so now I think I've been on my thyroid medicine 6 months, and sleeping, happy, playing with my child at the park, going down the slide, chasing her, going to the beach. I'm back to myself.
Best way to contact me or get information about our practice or how to get involved with becoming a patient is to go to the bodylogicmd.com site, click on Colorado, my practice will come up. We'd love to hear from you.